As more of Ontario enters phase 2 tomorrow, occupational health nurses will have a huge challenge ahead of them, ensuring the health and safety of workers to minimize a possible second wave of COVID-19. For more, we're joined by Lena DiCarlo, occupational health nurse and former president of Occupational Health Nurses Association. Good to talk to you today.
Good morning.
Okay, so let's talk about occupational health nurses. Do not work in a hospital every day like other healthcare workers, and so people might forget or possibly not understand the risks you face, especially in a pandemic. So what are those added risks?
Well, first of all, we do have occupational health nurses that do work in the healthcare sector and in manufacturing and other industries. So the risks are really somewhat the same in the sense that we're managing potential cases, we're managing the fear of our employees being exposed, having them understand what the pandemic is all about and what preventive measures they could take. So the foundation of what we do is really to maintain, promote, and restore health and safety in the workplace. So as frontline workers take care of patients, the workers are our patients, and so we're advocates for them. So we work very hard with key players in our organization to put the right kind of systems in place to protect them from all kinds of hazards, including communicable diseases. So this pandemic is unlike anything that we've seen, at least in my lifetime. And so having the right kind of processes to protect them is really important. So it's been quite a whirlwind since February.
Yeah, absolutely. What are you most worried about?
Well, I think the mental health state of our workers and having them have the tools to navigate this difficult time and know that employers are doing as much as they can to protect them. And as occupational health nurses, that's really what our forte is to guide, to facilitate, to promote, to understand what kind of processes you need to put in place to safeguard the health and wellness of our employees.
And what about compensation, too? I mean, in April, we know the Ontario government announced a pay bump for healthcare workers on the front lines, but occupational health nurses were not included on that list. Did that surprise you?
It did and it didn't. I think there is a lack of awareness of our specialty and what value we add to organizations. And so was I disappointed? Yes. I think as an organization, we work very hard to be strong advocates for health and safety of the workers, and we put ourselves at risk. We're working very hard. We're navigating this whole world with employees, managing their exposures, their illnesses if they've acquired the disease. And so it was a disappointment, to say the least. And I think this is a good opportunity to sort of showcase who we are and what value we bring to the organizations.
So what changes or support would you like to see from the provincial government?
Well, I think that an awareness, first of all, of who we are and what we do and our value in the workplaces. And most leading employers have occupational health nurses on site, but there are many who don't. And so they're left at risk. So I believe that bringing about an awareness and being acknowledged for the work that we do to safeguard employees, because if employees aren't there to do the work, then who's taking care of the business or who's taking care of the patients?
Lena, we do appreciate all the work that occupational health therapists and frontline workers and nurses do. Thank you for your time today.
Oh, thank you for having us on behalf of the Occupational Health Nurses Association. Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.